Contrary to its name, menopause does not affect men, but women. Well, what is menopause? What causes it? And what can be done about it? Menopause, simply put, is the end of menses, or menstruation. And that sounds great, right, ladies? No more cramps, cravings, or periods. Well, that may be true, but it also comes with a lot of frustrating symptoms as well. These symptoms can range from mild to severe, from annoying to downright awful. When a woman goes through menopause, she goes on a hormonal roller coaster called the perimenopausal period. Menopause is not a one-time event. It occurs over a period of 5 to 10 years. Some months feel normal, but some may be completely abnormal. During menopause, a woman will experience menstrual period changes. Her periods may start to get closer together or much farther apart. PMS, or premenstrual syndrome, gets much, much worse. Women who have never experienced PMS may start to, and women who already experience PMS will experience it in a whole new, terrible way. They will become irrational, irritable, paranoid, and angry. Some women will also undergo terrible migraines during menopause. Many perimenopausal women will also battle insomnia, causing extreme fatigue. Women may have joint aches and pains similar to flu-like symptoms. They can also experience poor concentration and memory, often not being able to come up with names of places, people, and things. They can lose ambition in their ability to multitask, which many women pride themselves on. They may also experience the inability to cope with changes. Hot flashes and night sweats are extremely common and can last from several seconds to a few minutes, and can be just plain embarrassing, or they can even interfere with daily life. The hair on her head will start to thin and facial hair may start to grow due to a new imbalance of testosterone and estrogen, which can severely decrease confidence. There are changes in the urogenital region, such as vaginal dryness and irritation, leading to a loss of libido and sex drive. In peri- and postmenopausal women will also have increased visceral fat accumulation, meaning fat accumulation in the abdominal region, which is characteristic to male weight gain, losing their feminine pear shape and gaining a more androgynous apple shape. And finally, menopause increases the risk of many diseases such as osteoporosis, cardiovascular disease, Alzheimer's, and colorectal cancer. Hormone replacement therapy is able to help many of these symptoms, and there are many different types of therapies available to help that can fit many different needs. There are local treatments, estrogen creams, suppository tablets, and vaginal rings that can help genitourinary symptoms, as well as whole body treatments like pills. There are also treatments that just include estrogen, and some that include both estrogen and progesterone. If a woman still has her uterus, meaning they did not have it removed during a hysterectomy, they should take treatments that have progestin, the synthetic form of progesterone, in them, and not take treatments of estrogen alone. Doing so could increase the risk of endometrial cancer. Because the cells of your endometrium or uterine lining aren't being shed each month during menstruation, they will build up and may cause cancer. By taking progesterone in addition to estrogen, you lower the risk because progesterone thins the lining of the uterus. Estrase, Estratab, and Premarin are just a few examples of estrogen-only pills. Most estrogen pills are taken once a day without food. These pills can reduce or resolve troublesome symptoms of menopause, as well as lowering the risk of osteoporosis. Liviol is an estrogenic, progesterogenic, and testosterogenic oral medication that treats these symptoms, in addition to increasing libido due to its testosterogenic properties. The risks of oral hormone replacement therapy has been very publicly announced. Taking estrogen alone increases the risk of stroke, blood clots, and uterine cancer, and taking estrogen combined with progesterone increases the risk of breast cancer and heart attack. In addition, like all medication, there are possible side effects. These include painful, swollen breasts, vaginal discharge, headache, and nausea. Oral estrogen is also hard on the stomach and liver, so those with liver damage, stomach issues, or high cholesterol should seek other treatment methods. Skin patches are another alternative method of HRT. Alora, Climera, Estroderm, and Vival Dot are all good examples of estrogen-only HRT patches. Climera Pro and Combi Patch are combination estrogen and progesterone patches. Menestrar is another type of patch that contains a very low dose of estrogen and is only used to reduce the risk of osteoporosis. It does not treat any other symptom of menopause. To use these patches, you place the patch on the lower stomach beneath the waistline and would change the patch according to the instructions, typically changing it once or twice a week. This method of HRT is very convenient. Instead of remembering to take a pill every day, you can just stick the patch on your body and you are good for a few days. Patches are also a good alternative for those with liver damage because the estrogen bypasses the liver and goes directly into the bloodstream. Not as much research has gone into estrogen patches in regards to blood clots, so for now we must assume that estrogen patches pose the same risk, a very small increase in the risk of problems such as cancer and stroke. They can also cause breast tenderness, vaginal discharge, headache, and nausea, just like oral HRT, and the patch may irritate the skin where it was applied as well. You must also be careful to avoid high heat and sun exposure on the patch because they can cause the patch to release the hormones too quickly. Topical creams, gels, and sprays are another alternative. Estrogen gels like Estrogen Divigel and creams like Evimus offer another method to get estrogen into the body. This method is similar to the patch in that the estrogen is absorbed through the skin, directly into the bloodstream, bypassing the liver, making it safe for those with liver damage, stomach issues, and high cholesterol. These gels are applied in certain specific areas of the body. Estrogel and Evimus are applied directly to one arm, from the wrist to the shoulder, and Estrozorb is applied to both legs. This treatment method has not been well studied either, so it is assumed that they pose the same risk as the oral medication. Another issue is that the cream or gel may wash or rub off before it is totally absorbed. It is also imperative with this treatment that no other family members touch these creams or gels because they will then be exposed to the estrogen. And finally, local treatments such as vaginal suppositories, rings, and creams are available for women who would like to locally treat urogenital symptoms of menopause. These treatments are applied directly to the vaginal area to treat women with urogenital issues, specifically vaginal dryness, itchiness, and painful intercourse. Vaginal tablets like Vagifem, creams such as Estrates or Premarin, and insertable vaginal rings like Estring and Femring are available. Vaginal rings need to be replaced every 3 months, making them very convenient. Vaginal suppositories or tablets are used daily at first, and then biweekly. Creams can be used daily or weekly. These treatment methods are better at treating the urogenital symptoms of menopause than other forms of HRT. Full body hormone replacement should also be used in combination with local estrogen to help treat vaginal symptoms. These local treatments are also regarded as being safer than whole body treatments because they are low dose and only affect the immediate area, theoretically reducing the serious risk of HRT. In addition, most doctors do not recommend local estrogen therapy to women who still have their uterus because of the risk of endometrial cancer. How, as women, do we make a choice whether or not to use HRT?
So menopause is defined as going for a year without having a menstrual period. And this is caused by hormonal changes in the body, which include a decrease in your estrogen and progesterone. When you have a decrease in these hormones, you may experience symptoms that go along with the perimenopause and menopausal time frame. And those include vasomotor symptoms, which is a fancy word for hot flashes, which can also cause sleep deprivation. And another very common symptom is vaginal dryness. When we're treating menopause with hormone replacement therapy, we have two options for treatment: estrogen alone or estrogen with progesterone. Every woman experiences menopausal symptoms differently, and therefore the treatment has to be tailored to each woman. And her individual medical history and family history are all part of that. And oftentimes we have to try one medication, maybe change the dose, maybe change to a different medication that works better for them. So it's all a tailor-fit prescription for the patient. So it is either an estrogen or an estrogen with a progesterone. It can be delivered in a variety of ways. So it can be in a daily pill. It can also be a spray, a gel, patch, are all different mechanisms of delivering this hormone. Lots of women are going through menopause, and many of them will require some form of treatment to help with the symptoms. But the bottom line is to talk to your doctor about your symptoms and what you're experiencing, and let them help you figure out what the best course of action for you is.
There is no reason to use hormone replacement therapy after menopause if you are over the age of 50 and do not have unmanageable symptoms. HRT should be used for premature menopause. Some women are unlucky enough to go through menopause naturally or surgically as early as the late teens, early 20s, and it should be used until the age at which they would normally naturally experience menopause, around the age of 51. HRT used at a young age, less than 60, also reduces death rate. Yes, the risk of certain cancer increases with these therapies, but the risk is the exact same as if your ovaries had still been working and producing estrogen. This is not a decision you should take lightly. Talk to your doctor, your family, and your friends, and see if hormone replacement therapy is right for you.